Hi, welcome to the Ashley Latter's latest Luncheon and Learn. The title of this video is called Low Hanging Fruit. There's a great saying in the marketing world which is called low hanging fruit. And basically what low hanging fruit means is where your best opportunities are, that's the easiest opportunities within your dental practice. So let me give you an example of what low hanging fruit may be. I was recently, just a few weeks ago, working in a dental practice. This particular dental practice place implants and they really want to start growing their numbers. So I went down and helped them with some of the marketing, some of the ethical sales. I also helped them with how to provide a world-class patient journey, and when every new inquiries were coming in, how to make sure that they converted them to that particular practice. So I got a chance to work with the whole team. And one of the conversations we're having is how to get more referrals from dentists who are introducing implant opportunities to this practice. And we talked about some ideas. But then I asked them, and this particular practice, by the way, had about 15 dentists. I asked them, how many extractions do you do in a year? I also asked them, how many patients have got maybe dentures who are a little bit loose and they're not happy with? Now, the figure they came up with was many thousands. I just couldn't believe it. And yet, if you correlated it to how many implants they were placing, it was something like 0.005%. And I turned around and said, well, you know, it's great, it's important that we're going to get more referrals from outside, but look at the patients you've got here. This is low-hanging fruit. And think about what conversations do you have with these patients now? And do they honestly know a patient who has an extraction or maybe has a loose denture, do they honestly know that an implant's a solution they can possibly have, that's a fixed solution that actually just might change their lives? And the answer to the question was probably not. So we came up with something which was called a general benefit statement. So a general benefit statement is a statement that you give to the patients. It's like a 30-second advert. So let me give you an example of an implant general benefit statement. So this is a question you could ask a patient who maybe has a loose denture they're not happy with, or maybe they're about to have an extraction, or maybe they've already had an extraction. And you can say to the patient, Mrs. Jones, are you happy with that denture? Do you find it sometimes affecting your eating, or do you find it, you can't chew or eat certain foods? Do you lack confidence with it? Or Mrs. Jones, you've got that space. Have you ever considered how you'd like it filled? The reason why I'm saying that is we have an implant, and an implant is like a fixed solution. It's like the nearest thing to your nearest tooth. In fact, it feels and functions like a normal tooth, which means it doesn't move and it can fill the gap. But the major benefit is what you can do is you can chew, you can eat certain foods without ever worrying about it falling out. And implants are really the gold standard solution and can actually start from as little as something, £70–80 per month. Is that something that you might like to explore or take a further discussion about? So that's it. You're just sharing what we call a general benefit statement. It's a statement which says, here's what an implant is, here's what the benefit is, and this is what it's going to mean to you. This is what it allows you to do. And we're all communicating that, and it's all in layman's terms so that the patient can clearly understand that. Now we obviously introduced that statement, and they started to have different conversations. And what's happened as a direct result is they've already created more opportunities to place more implants with existing patients. So I hope this has been useful, and maybe go back to your own practice, get your team together, have a chat amongst yourselves and think to ourselves, have we got any low-hanging fruit, any opportunities that are really here in our practice without having to spend thousands of pounds on marketing or attracting new patients? Have you got any low-hanging fruit in your dental practice?